Think of yourself throughout your teenage years. On one hand, you have exposure to so many new freedoms, so many new experiences, so many new people, but then on the other hand, you're exposed to so many hormonal changes and overwhelming peer pressure. My name is Christine Pattillo, and this fall I'm attending Belmont University as an undergraduate biology student with a passion in reproductive health. Reproductive health is extremely important, especially to adolescents who are experiencing so many new things. However, it's important to consider which strategy should be used, comprehensive or abstinence only, to discuss these topics with teenagers. In a 2019 Centers for Disease Control and Prevention, better known as CDC study, it was found that 37.6% of females and 39.2% of males between the ages of 15 and 19 engage in sexual intercourse. Comprehensive sexual education can provide these sexually active teenagers with complete, medically accurate information on so many things such as safe sex practices, contraceptives, the emotional impact of sex, consent, and so much more. The abstinence-only sexual education approach, on the other hand, really can't even be described as a sexual education. Instead, it's a strive for the utopia, the perfect world. Do not have sex, and you will not have these health consequences. Though the message at its core is moral, it's unachievable, and it elicits fear amongst so many teenagers, and those who it doesn't elicit fear amongst believe it is insufficient and insignificant. Abstinence-only sexual education should not be chosen over that of comprehensive sexual education due to its failure of in-depth conversation, inclusivity, and a sense of trust. Abstinence-only sex education fails at creating a foundation upon which teenagers can build and benefit their own health and relationships. Those who promote an abstinence-only sexual education do so in belief that it benefits physical health. Too many unwanted health risks are there. By bypassing the fundamentals, they believe that they also bypass related health risks. Furthermore, they advocate for the importance of avoiding sex, administering discussions of the dangers of STIs and other risks. The Gale Opposing Viewpoints article on sex education 2022 explained that abstinence-only programs usually steer clear of discussion on contraceptive methods and barriers to protect against STIs, as many believe that by providing this information, they're refuting the abstinence-only message. This simple miscommunication of information denies teenagers the ability to protect their own bodily autonomy in a case that the situation is to occur. Abstinence-only educators claim that by providing teenagers with information on safe sex practices inherently encourages them to be sexually active. This isn't true. This potential increase in sexual activity would, as they see it, result in morally harmful outcomes. Discussing thorough information does not guarantee that they will be sexually active, though. It does, on the other hand, guarantee that those who are sexually active will be doing it safely. An understanding of their own bodies would better benefit a teenager's physical health despite whether they are sexually active or not. Another con to the abstinence-only sexual education approach is that it exposes teenagers only to the education of that for a heterosexual relationship. In their 2019 article discussing the complications within sexual education, Caitlin Bodnar and Samantha L. Tornello expanded that sexual minority youth often feels their programs villainize same-sex sexual behaviors, ensuring couples to be assumed to be comprised of a man or a woman. LGBTQ+ teenagers are denied chance of understanding their own sexual health through abstinence-only sexual education. Furthermore, STI discussion often singles out homosexual males, a repercussion of the HIV epidemic that happened in the late 1980s. Examples of responses to the crisis can be seen through my visual aid. This adds on to the stigma that LGBTQ+ adolescents do not deserve to be taught how to manage their health. In an article highlighting discriminatory sexual education written by Delilah Rose Chandlin in 2022, it is explained that due to the inability to discuss sexual health outside of the heterosexual norm, heterosexual students are simultaneously being sent an insinuated message that there is something inherently wrong with their peers. Hardly any attempt has been made to fix this. Besides the exclusion of LGBTQ+ community, ingrained stereotypes within abstinence-only sexual education also harms the classic heterosexual couple. This is due to the push of unnecessary gender stereotypes aligned with misogyny. These stereotypes all derive from one core belief, that men have to be dominant in a relationship. Studies have found that individuals that adhere to harmful gender attitudes are significantly less likely than those who do not use contraceptives or condoms. This was found in a 2015 article by Haberland. Women who gravitate toward relationships founded by harmful gender norms are significantly more likely to experience sexual health risks such as STIs and unwanted pregnancies. Abstinence-only sexual education fails at avoiding this, as a typical male-female relationship is often depicted in a way where the male is dominant, and topics such as emotional aspects of sexual relationships and consent are not discussed. As a result of the failure to discuss things such as this, teenagers don't trust adults with their reproductive health issues. Set up with the belief that sex is something shameful and to be avoided, many don't want to reach out, believing that they will face repercussions for their actions. Teaching an abstinence-only curriculum does not lead kids to steer away from sex, but instead builds a sense of distrust for those who push them to do so. Shelby Astell quotes a student from her survey in her article, "The more you try to force abstinence on a kid, the more they're going to try and rebel and say, oh no. Distrust in the education leads more to unsafe practices, ultimately leading to more risk and more unwanted pregnancies. This distrust is not only built from miseducation, but also from the lack of inclusivity." Chamlin stated that fewer than 5% of LGBTQ+ students have health classes that includes positive representation. Without any positive representation of their own identities, LGBTQ+ teenagers lose trust, believing reaching out will only cause them harm. The same can be said for young women. Astell found in many abstinence-only sexual education settings that discussions of social consequences often focused on female embarrassment. This was explained even more when it proved that teachers don't talk about topics such as periods or yeast infections. This educational method leaves young women left to feel speechless in their own bodies, unaware of how to communicate their sexual and reproductive health needs. Abstinence-only sex education is unable to provide adolescents with a foundation of reproductive health knowledge and conviction to address their own said health. A comprehensive sex education curriculum that communicates the basics of sexual relationships, consent, emotions attached to sexual relationship, contraceptives, in an open and inclusive approach, while even perhaps mentioning abstinence as a desired option, would be most beneficial to implement in both middle and high school programs. It is of best interest, though teenagers' youth can create a veil of innocence, to inform them of safe sex practices rather than to believe that they can be told what not to do and actually listen. Thank you so much for listening to this speech, and I hope you gained some knowledge out of it.